It's much easier for people that just want to be doctors and nurses and input into an EMR to use a system, my analogy, much more like the iPad. You sit down, turn on the iPad, and go. So an EMR that does that kind of instant connection functionality without having to learn to speak a lot of computer works much better in my mind as an EMR than not.
I'm very excited about the evolving fusion that is happening between nursing and informatics.
If we ask ourselves, why are we going to EMRs? What's the point? I think what an EMR does so well, once you get past the learning of it and use of it and familiar with it, is its tremendous record keeping, safety, chemotherapy ordering, drug-drug interaction, test ordering, data retrieval, involved with clinical trials. But perhaps the most important of this is, once it's all in there, is getting the data back out. So for safety, recently I was on call, number of doctors in my group, so a patient calls, has a problem, instantly I can pull up that patient's record, web-based, very important, so I can do it from home, at the office, on the road, and see what's the matter with the patient, what's likely to be going on, all because of instant data retrieval.
In the past, initial nursing assessment would take 60 to 90 minutes to complete, which would occupy a lot of nursing time. Now with the ICC Oncology tools, it cuts the time to half, if not more.
Interestingly, today in the office I saw a new patient, and her husband was in the pharmaceutical industry and in IT, and saw me working as I talked with his wife and back and forth to the computer, said, "How do you like your EMR?" And I said, "Well, it's really very robust and very functional, but it was probably written by a computer genius who didn't have a doctor or nurse within 20 miles of him when he wrote it." So the question often comes up, how do you choose an EMR? I was asked this question just the other day by a colleague who doesn't have one and was thinking of getting one, asking me about ours. And I said to him, "What smartphone do you have?" He said, "Well, I have an iPhone." And I said, "Well, there's an iPhone, there's Android phones, there's HTC, there's a new Samsung phone. They're all good, but they're all a little different. And so it's a very personal thing, and you have to decide what functionality you want. It's much easier for people that just want to be doctors and nurses and input into an EMR to use a system, my analogy, much more like the iPad. You sit down, turn on the iPad, and go."
I have colleagues who do not even have email addresses, never held a smartphone, don't know what Facebook is, yet they're able to navigate through the ICC Oncology tools with ease.
So recently, as I've been looking at EMRs, as I go to meetings and talk to other colleagues and use ours, I had occasion to see the ICC EMR clinical platform. And I was really struck by the ease of use.
It's very user-friendly. It has menus, queues, drop-down menus, queues, and alerts, which makes it user-friendly. Information can be shared through nursing, physicians, dietetics, research assistants, psychology.
For those of us who remember what it was like to open a chart and you'd tab to graphs of clinical labs, x-rays, pathology reports, old letters, and find them rather easily and go to those sections as opposed to having to learn computerese to go around. The ICC EMR clinical platform does that and almost takes you back to the old days of when you had a regular paper chart. Very much more the iPad experience of just sit down, ask the computer, the program to show you things, as opposed to learn the computer language of an EMR, which is much more PC and technical.